Hello, everybody. My name is Dr. Krista Augius, and I am an integrative physiotherapist. And I've been asked to speak today for the benefit of anybody with Chiari watching, as I've had a few presentations here before, and I'm going to be talking about the same kind of information that I've shared, but more as just a discussion this time than presenting slides and having little diagrams and things. So my background is that I'm a physiotherapist, and I've been practicing since 2003. So it's been a while. And getting into therapy, I spent some time in the neuro rehab unit. And so I worked with brain injuries and people with strokes, and really got to love the neurological aspect of therapy and movement and rehabilitation. And I really do have a deep appreciation for the power of our brain and our bodies and the way that it all works together. So that was actually one of my favorite rotations, was in that place, because your neurological system is the basic primary system in your body. It's when you are developing as a baby in your mom's belly, your neural tube is at the center of everything, and then it branches out, and then all these nerve endings communicate with your organs and your muscles to have you function and move. So it's pretty phenomenal. And I also have a love of orthopedics, and basically how the musculoskeletal system houses us in these bodies, and how all this nervous tissue goes through it and establishes basically a balanced system. So I wanted to revisit the topics of the importance of posture and how that affects your brain and your peripheral nervous system. And basically, it's the neurofascial system, and how we can treat that when symptoms start to arise, especially with like in a normal global population. Everybody has places where their posture can be improved, their joints can be more mobile or more stable, and their neurofascial system also can be more mobile or stable. And then I'm going to branch off a little bit, and I will also speak about how trauma and pain, which is trauma, gets held in the body and affects the neurofascial system. Okay, so that's my overview, is neurofascial, and then the orthopedic system, the musculoskeletal system, and then we're going to go into trauma and pain and how it's stored. Okay, so actually I'll start with the orthopedic system and the posture. Okay, so, and to review for with people with Chiari, that you have more pressure on your spinal cord and your nervous system because of the drop of the cerebellum down into the tube. So this is going to affect you, because first of all, it's uncomfortable. And one of the bigger things is pain and how to manage pain. And so the first thing that you really can do is, ask for help, and from a professional who really understands anatomy and posture, and who can work delicately and sensitively with the body, because nervous tissue is very sensitive. It's basically your feelers and your response system. So having somebody to work with you on establishing what posture is good for you and not forcing you anywhere, or overstretching you or over exercising you is something that I always review because it's important. So an upright postural system has the most benefit for the nerve movement. Okay. Once you can actually get your body in alignment, because your body moves in all kinds of planes, forward and backward, side to side, and then it actually bends this way. And then there's, all the combinations of all the movement in between. So sometimes our posture, your bones and the muscles that hold it in place can actually have habituated because of compensation from anything, not even just having Chiari, but like you had a trip or a fall when you were an athlete in high school and you never really rehabbed it. And so you might be asymmetrical. And so in your pelvis, and then your spine might be a little bit off. And then that actually puts a little bit extra pressure where your head sits on your neck. So we want to address all those things, because whenever you're not in alignment, then your nervous tissue gets pulled. And when your nervous tissue gets pulled and stays like that, then the pattern becomes more ingrained. And it takes more time to unwind it. So with neurofascial treatments, you're in a resting position and it's in a very calm environment, with starting with breath work and really allowing the body to relax into its state of being. And with breath, you actually induce your natural neurochemicals that help relieve pain. And actually, the more that you practice breathing and getting into a state of relaxation, and then having this knowing that you have somewhere to go, that you become accustomed to, and you train yourself to be there, the more often you can actually default or come down a few levels from, if you're having a bad pain day, then you can actually calm your system down and breathe into it and breathe with it. So as a practitioner, first, we want to create that comfortable, safe, relaxing space so that your body can actually let go and your mind can actually let go and control of your body. Sometimes it takes 15, 20 minutes for somebody to actually really release the day or the last conversation that they had with somebody, or breathing through a pain place and positioning it so that it's more comfortable, so then you actually can start to rest. And then when you work with the neurofascial system, it's actually very gentle. And I usually start by just holding somebody's head, and I get an appreciation for these small, minute ways of how your skin glides, or your scalp, the skin of your scalp glides on your skull, and just a feeling for the fascial movement in all these different planes. So I would test like forward and back. I can test rotation, see what the movement is like. And so I'm looking for the movement that's smooth and symmetrical and free. And then you get an amplitude and a rate of movement as well, because your body is actually at rest. It's actually moving inside. And there's all these things that you can feel, which is just incredible. But so first there's this assessment. And then when I find something of a movement that actually triggers something, so another sensation, sometimes distally, like I can be holding somebody's head and they're like, I'm starting to feel something in my toe or my ankle. And it could be just a response from meeting the movement and the end of the movement where it is. And so we back off a little bit, and then actually we can approach it just really subtly. And I end up holding that resistance point. So this is where that pain trauma topic starts to come in, because when you get to an area that is holding or is resistant and it's deeper, well, there's all kinds of layers to that resistance, but yeah, we'll say the resistance point. There's really not a lot of opportunities in life for us to hold our resistance points and to just hold them at the point where you're like, oh, I can't actually go all that way, right? This side's like, whoo, okay, I can go that way. And then I get to here and I'm like, oh, wow, I can't go that way. And to be held there and for the tissue to actually feel like there's a buildup of like, oh yeah, I can't move that way. And then there's a system response that there's always fluctuation in the body. And then they're like, oh yeah, you're just holding it there. So it actually starts to build up and recognize that there's a hold. And then after some time, the body's like, oh, okay. And you move in, it actually gives way and you move. So then that fascia and the nervous tissue that's intertwined with all this fascia, it's also fascia through muscles, gets to be released. And there is this relieving effect. And sometimes those hold points hold emotion, because it could be this one point, like, most of us can relate that you hold stress somewhere in your body. Like, oh, you're sitting at the computer and you just start to get more and more involved in your screen. And then after a while, you're just like, oh my God, put those shoulders down. And then you're like, take a breath and you relax. But there's a point there in all that's buildup of resistance. And so actually, if you held on to that point and you felt, oh, that point where I hold my shoulders up and I can hold it and be like, no, there's a feeling that can get better here, and you don't even realize it. And then the more you realize it, your body drops and drops and drops into it. Sometimes that positional hold is associated with a particular stress. It can be fear. It can be anger. It can be, really any emotion that we experience, and then we hold that emotion. And then when that physical point is able to release, the emotional point releases as well, which is really quite a beautiful experience, because then you have the opportunity to let it go and come into a deeper state of body and mind relaxation. So not only do you get physical movement in the body, there's a release of this internal stress of the body, because we're working with the nervous system, and the nervous system is our primary controller. So it's like everything goes through that. So starting with holding the head, these points are really everywhere, anywhere in the body. But with people with Chiari, it's really a good relieving system to start in the head or the feet. And, you know, it's like you can relate to it that it might feel or be similar to a version of like what they call traction, even though it's traction is way more, I would say, not even aggressive, but it's neurofascial releases are very, very sensitive and subtle. And you could be at one point for quite a while just waiting for it to let go and not actually inducing a movement. You actually just take up the slack of what your body is willing to give. And so there's not like a flare response afterwards. Okay, so we went over posture and the importance of alignment and how your body is anatomically stacked up for a certain way of movement. And if you're not in that alignment for whatever reason, then you're going to be putting tension on your body and your fascial system and your neurofascial system. And so the way that your neurofascial system is most happy is actually when it's in a stable environment. So your posture, not only is it in the right place, but it's flexible in the right ways and stable and strong in the right ways to support your internal nervous system. And then the treatment of what neurofascial is like a subtle, sensitive whole testing of the movement that's available, holding it in the range that is available and waiting for the feedback of being held in that place to build up and then release, and how that also releases emotional holds and stress and trauma and pain, and how the body can feel better, be more relieved and more at ease. And then actually you can get to the next level of unwinding or the next postural release so that you can get to a better position. So it's kind of like this whole big circle that feeds into itself. So I think I'll pause here and see if there are any questions based on what I've said so far.
Hey, so I do actually have a couple questions. It's incredibly fascinating to hear this so far. I think the process that you've outlined is, it seems almost like a really individualized process. And I think a lot of patients with Chiari can appreciate the time and effort you're putting in to think about each person kind of on an individual basis. I'm sure not everyone gets that routinely. And that kind of leads to my first question, kind of starting from the very beginning is, I'm sure everyone, a lot of people listening would love to see you specifically based on what you're seeing, but obviously, we all live in different parts of the country and even potentially the world that listen to these. How does someone go about, finding a professional that is trustworthy to perform these kind of maneuvers? Where can they start?
Yeah, that's a really great question. So I studied with the Upledger Institute that does cranial sacral therapy training, which is now the Barral Institute. And so you can go on their website and search for practitioners according to your zip code. And then I think it's a good idea to, call up the person and just have a chat with them and see what your goals are and how that person matches up with that.
Perfect. And so once someone has kind of established, they've maybe discussed some of their goals and we start working together. One specific thing that came to mind when you were talking about resistance points specifically, is there anything that helps you on the end of the provider and the person performing these procedures and these strategies? Is there anything that while we're doing this, maybe while we're holding at a resistance point, is there any kind of feedback you look for during from the patient? Like the patient to say, hey, this is painful or this is too far. I mean, what kind of feedback and interactions do you look for from the patients that they can make the experience a little bit better?
Good question. So I always preface the beginning of the sessions with, you can voice anything at any time. We can talk about anything anytime. So it's really like feeling comfortable just saying what you're experiencing. Um, I have a lot of visual feedback from the body, because as neural fascia starts to release, you can see the body kind of give these jumps and little ticks, kind of like when you're falling asleep and then your leg goes. So there's a bunch of those movements, or like joints release, and you can hear the click. So um, I'm very aware, or your practitioner should be very aware of actually what's going on. And there is a difference between listening and taking up feedback from the body versus having a plan and an agenda of what you as a practitioner are going to do. So the latter can cause maybe things to go a little too fast. And then that would be the point where a person who's being treated can say, like, hey, I think that's a little bit too much. Can we back off and start over, go into it again?
Perfect, perfect. And then kind of thinking, I think the last question I have so far from what you've gone over so far. So one thing that I think really hit home that you talked about was this kind of conversion into this tightness and these physical manifestations of stress and bad conversations and being overwhelmed, and kind of that relationship between everything going on that we all face in life and a real physical manifestation of that we have to work through. It's kind of this vicious cycle that we can sometimes get into, right? And so I think my question is, if you're, kind of developing like a longitudinal plan with a patient, so we're doing the sessions, is there anything that you're guiding patients on to do potentially at home that not only can, or potentially, I guess, could prevent some of those emotional things from being converted into physical pain? Is there kind of a prevention type strategy or home exercises, anything like that that you would recommend for patients routinely?
Yes. So there's a plethora of tools available for people to self manage. And I think that it's actually really important for your provider to be looked at as a facilitator, to like give you as many goodies in your bag that, like, because like every day is different, that you could reach in your bag and know, like, oh, today I have this kind of pain, and I know this kind of pain means like I need to relax more, and this kind of pain means I need to strengthen and stabilize more. So in general, to answer, like, my recommendations of things to do are breathing exercises, meditation. I'm a teacher of that also. And it's really important. Like, when I first started my training as a teacher, it was a 9-month process. And as a class, we were assigned 31-day meditations that were 31 minutes a day. And they were with specific postures, breath, and actual mantras also. So things you say and vowels that come out of your mouth, and you actually vibrate your skull, and your neuroendocrine system gets stimulated that way. That 30 doing things in repetition. So that's like, that would be a goal, I think, for anybody. But doing things in repetition, even as small as a minute a day, then 3 minutes a day, builds your repertoire of, how I said in the beginning, your safe house of, like, okay, I know that place exists in me. Then when something bigger happens, I can go exactly to that place easier than having to try to go there and do a breathing exercise in the midst of a chaotic, painful moment. So investing and making a routine, and making your life a routine that you integrate that step, is fundamental and phenomenal for most people. Like, everybody needs to basically check in, and where is home base? And so breathing and meditation, and then having a a basic routine of where your exercise program is, because we know, like, you know, those positive neurochemicals get released. So walking, if we can walk for 5, 10, 15, 20, 30 minutes a day would be amazing. And then your specific exercises that keep you in your postural position, because everything in our life is pretty much forward and we're all gravitating to be forward. So it's like we need these little checks of, like, while I'm brushing my teeth, I'm going to make sure that my chin is slightly tucked and my head is up, and I'm going to look at myself in the mirror and take a breath and like really fill the space of my body. And I'm going to do that for 30 seconds while I'm brushing my teeth twice a day. Just like integration of your check marks, your daily check marks, so that it becomes part of your foundation. So I would look for those kinds of things.
I think you said just a couple really just refreshing things that I take away from that is, the first thing is, putting in little investments on a daily basis or a couple minutes at a time, and you're setting this long-term foundation with just small adjustments at first, because I think it can feel really daunting with someone's trying to start meditation or an exercise regimen or something where it seems like I don't even know where to start. I'm so overwhelmed. I know I want to feel good, but this is just too big of a task. I don't feel I have the energy. But I think it's so nice to hear that just making little itty bitty steps at a time just builds you onto this long-term trajectory. I think that's really just great to kind of remind everyone about. And I think the other thing you said that I think is really important, not just for people with Chiari, but also kind of any chronic neurologic condition or chronic disease in general, is you kind of made a point of saying that on certain days, maybe this is my pain this day, but the next day, maybe it's this. And the fact that we kind of, fluctuate or ebb and flow every single day, and it's a learning curve, and no day might be the same as the next. And I think it's nice to hear that you're helping patients kind of navigate those fluctuations and build a really diverse toolbox for kind of whatever comes. I think that's really refreshing to hear for probably a lot of people listening. Well,
Good.
I think those are kind of questions that came to mind, but I will hand it back to you kind of for continuing thoughts or anything else kind of you had lined up for us.
Yeah, that's pretty much all I had to offer for today. Yeah, I think I have
Perfect.
some previous ones where I have the slides of the posture and the muscles, and then how the fascial system kind of works. So we can
Perfect.
build on this. Yeah.
Yeah, no, that sounds great. Okay. Perfect. Well, again, thank you so much. I really appreciate your time. It was
Yeah, I
fabulous.
appreciate you too.
Yeah. Okay. Well, we will be in touch. I again really appreciate it. Thank you so much.
Okay.
Have a good
Take
night.
care. Okay.
Bye
Bye.
bye.